Okay, next I'm going to do some of the special tests. The first one is just hip scoring, and this one is just checking for a labral pathology. Pain indicated, like if she's in pain, you're going to assume labral pathology and then do more tests. First one, we're just going to put her leg on my shoulder like this, put my hands like this, flex her knee all the way, and then you're pushing down. Push internally, push externally. Any pain?
No.
All good. The torque test, it's a little hard because I don't have a table, but what you would do is I would put my hand under her femur, the middle of her femur, and push down on her distal thigh. If she feels any pain, that's an indicated stretch fracture of the femur. Next is the 90-90 straight leg test. I'm just going to have my patient lift up both her knees and then lift up this leg for me. Lift up this leg for me. Okay, put both of them down, please. And that is just checking for whether or not her hamstrings are tight or loose. The Faber test, Patrick Faber test, go ahead and put your heel on this knee for me. Make a 4. And you're just seeing how far down their knee goes from the ground. And that's checking for the SI joint involvement. Go ahead and do it with your other leg for me. Okay, perfect. And then Trendelenburg's test I did in the other video. Next test is Ober's test. Go ahead and have your patient roll on the other side. These ones are a little easier on a table, but I don't have a table available to me. So you're gonna flex the patient's knee. The way I like to do this is I like to hold her with one hand on her hip and put my arm on the other hand on her calves, and then just tell the patient to relax. And you're gonna slowly drop the leg to check for a tight IT band. In this case, it should just fall right down. Then you're going to go on to piriformis test to check for piriformis syndrome, if there's tightness in their butt or in their hip. And you're just checking to see, again, whether or not their leg falls. Once again, it's easier on a table. And then Thomas test, you would have their patients back up against the table, hold one leg, and fall backwards onto the table cautiously to check for the rectus femoris and lack of hip extension in their legs. But once again, I don't have a table available to me.